The abstract is about advancing cervical cancer prevention through screen and treat strategy among the HIV positive women in Murang'a County Referral Hospital. So the background of the study, we were looking into issues according to the GlobeCan report of 2020, whereby comparing with the cancer of the breast, cervical cancer was the second in terms of incidence among cancer cases in women. And also in terms of mortality, the cancer of the cervix had the highest rate of mortality, standing at more than half of those who are diagnosed annually. Currently, we are at 9 women a day. We are losing 9 women a day due to cancer of the cervix, compared to 7 women a day due to the cancer of the breast. But our main area of focus is cancer of the cervix. So, as we all know that women living with HIV at 6 times higher risk of developing cancer of the cervix compared to the HIV negative women. So with the global effort to try and combat this issue of the surging cases of cervical cancer, there is a strategy that the WHO has adopted, which is the 90-70-90 strategy, where the aim is to eliminate cancer of the cervix by 2030, where the first 90 is about prevention, where we are vaccinating our young girls aged between 9 to 15 with the HPV vaccine. Then the 70 is about ensuring all women who are eligible for screening, that is of reproductive age and above, are offered screening. And then the last 90 is all the women who have been screened and they have been found to have either precancerous lesions or are suspicious for cervical cancer are offered treatment. So in our context in Murang'a County Referral Hospital, we looked at the data between January 2021 and May 2023, and we found out that a total of 76 women had screened positive for VIA, which is a screening test that is used to screen women for early signs of cervical cancer. And these women did not have access to treatment because we did not have the treatment option at the department. So all these women were referred for further management. So we had like 100% rate of referral for all those women who are found with the lesions. So we embarked in a journey to ensure that we streamline the cervical cancer prevention and also reduce the incidence in the case of cancers. And also there was a strategy that the one that we're talking about, the 90-70-90 that was adopted, had been rolled out in the country, and there was a series of a training that the healthcare workers were impacted with. So in our context, the clinicians at the Murang'a CCC and the nurses received training on the issue of cervical cancer screening using the visual inspection method, that is the VIA, and also the treatment using thermoablation for those women who screened via positive. And also now we had a list of those women who are eligible for screening with that method that we call visual inspection, where we take women of reproductive age, that is between 25 to 49 years of age. So those who were screened and the outcome was VIA positive and the lesion was less than 75% of the ectocervix, they received treatment with thermoablation. So as we'll see in our results. So this is a graph. So between June 2023 and end of Q1, that is end of March 2024, there was a total of 627 women who were screened at the Murang'a County Referral CCC. Out of these, 17 are screened biopositive. Those who screened biopositive, the eligibility criteria was those who had lesions which were occupying less than 75% of the ectocervix were supposed to be offered treatment with thermoablation. So they were 10, and all of them received treatment with thermoablation. We only referred 7 because the lesions were quite bigger. Therefore, the rate of referral declined significantly from 100% to around 49%. So in conclusion, screening and treatment strategy has demonstrated the effectiveness in preventing the progression of precancerous lesions to invasive cancer among the HIV positive women in Murang'a County Referral Hospital. So part of our recommendation included support by provision of more of these treatment machines. We have treatment machine is only the sub-county hospitals and the county referral hospital, whereas screening is taking place all over the county in health facilities. And also capacity building that healthcare workers, more healthcare workers be trained on the issue of screen and treat, because at the moment, most of them know how to screen, but they are not exposed to the treatment because of the lack of availability of the treatment devices in the respective facilities. Also, a continuous support supervision, continuous health education to our patients so that to increase the demand generation for the service. And also, I think it would be a good practice if the screen and treat strategy would be adopted maybe in the coming guidelines, because now we see cancer of the cervix as one of the factors we find as cause of death in our HIV clients. So it would be of benefit if all our healthcare workers who are working with the CCC programs and even other departments to adopt the screen and treat strategy so as to avert this death that sometimes we can't prevent because of late diagnosis. Thank you.
Thank you so much,
LVCT Health, and also we've been working with the team from Cambridge, the partners in health and research development, and also trainings from the National Cancer Control Program. Thank you.
Thank you so much, Mchapo. We appreciate it. So, ladies and gentlemen, we've come